We want to know what happens in the epileptic brain generally, regardless of the kind of animal model or the kind of epilepsy. And we're using new mathematical techniques, big data techniques, to try to crunch the numbers on how 100,000 genes across multiple time points in many different models of epilepsy are all interacting and give rise to the changes that we see in epilepsy. And we've got some good leads, and we've got some interesting compounds that we think might be able to interdict or stall this process of epilepsy. It's a very exciting time because we think we've got a tiger by the tail here. The best case scenario would be that in 10 years we have a treatment or a procedure where a patient will come in and whatever state of their epilepsy is, we'll stop it at that. It won't get progressively worse, right? So for somebody with a head trauma, they'll come in having had one seizure from the trauma, that's all they'll have. That's our best case scenario. For somebody with a, not an acquired epilepsy, but a genetic epilepsy, our best case scenario is that the moment they're diagnosed, we can give a treatment or some condition where they're not going to progressively get worse and worse and worse. They can just, the disease progression will stop, and then we can just deal, or the clinicians can deal with just the kind of seizure frequency that they have right now, knowing that it won't get worse. That, I think, is a pretty good scenario to go for. It's going to be a little while before we can fix mutations in the brain, but I think we're pretty close to be able to stop that mutation from making the brain worse and worse and worse and worse. That's the best case scenario.